Hello everyone, we are back with another educative video. This time we are talking about total knee replacement, TKR. There are a lot of doubts which we came across in OPD from various patients who are advised TKR. So we wanted to talk about those doubts, particularly with regards to the pain, post-operative pain and recovery time and the indications when we should go for surgery and who are the ideal candidates for surgery. TKR is advised for knee osteoarthritis, that is degenerative arthritis of the knee, based on certain specific indications. The most important indication and the must criteria is to have pain, the pain which is there at rest, pain which is obstructing the activities of daily living, and pain during the nights which disturbs the sleep. This is an absolute indication for your TKR. There are other relative indications when you have deformity, when you are not able to walk because of the gross deformity of your knees, then also you may be advised to go for TKR. But pain is a primary indication. Age is not an indication at all. Even if you are 90-year-old or 95-year-old, you may be fit to go for TKR. There are people who require this operation at the age of 25 also. People like rheumatoid arthritis and all that will operate at 25 years also. So age is not a specific criteria. You need to have pain, you need to have deformity, and X-ray will decide whether you can still wait for some more time, whether we can manage it with medication, physiotherapy, exercises, lifestyle modifications, or we should go for operation. So when we decide about the TKR, we'll take into consideration your symptoms and the radiographic findings. That's the first question. The second one is how long does the surgery last, how long you have to stay in the hospital, how long is the recovery period. Surgical time depends on again different factors, but usually it is done. The surgical proper time will be around 1.5 hours. Sometimes it extends to 2 hours. Operation takes this much of time for 95% of the people. There are very few people who might require little longer period because of their deformities or other conditions. And hospital stay, presently we are keeping the patient only for 2 to 3 days after operation based on the recovery. Again, if the patient recovery is delayed because of other medical conditions or because the pain tolerance is little less, for such reasons the stay might extend beyond 3 days. And overall recovery, when you are talking about recovery, complete recovery usually takes 4 to 6 weeks, but no patient of TKR stays in the bed. There is no complete bed rest for any TKR patient. On the day of surgery itself, we make the patient to walk with a walker. And in the next 48 hours, we usually make the patient to walk out of the bed. We make the patient to walk out of the room. We make the patient to go to the washroom with the walker without anybody else's support. So your recovery for independence happens on the day of surgery itself. Without any support, coming back to your normal daily routine will take between 4 to 6 weeks. The next important question everybody asks is the pain after the operation, during the physiotherapy, during the recovery. There's a huge misinformation and fear among a lot of people who are planning for total knee replacement with regards to this post-operative pain, the fear of physiotherapy. 90% of the people will not have any significant pain after operation if they follow the instructions correctly. Very few who had pain before for very long time with a deformity which is significant Such people may have a lot of pain initially after the surgery. And for all such patients, we have a specific, very customized pain management protocol. For every patient of TKR, we give equal importance to the pain management as much as we give the importance to the surgery itself. When it comes to this TKR protocol, we at Prathima have a very defined preoperative preparation, intraoperative care, and postoperative pain management, which gives you a comprehensive management of your pain and recovery. The pain management starts before surgery, and during operation we take care of multiple things to reduce the possibility of pain, and postoperatively we give extremely careful attendance to each and every patient's requirement for pain management. The next question most of the people would be looking at is the cost of the surgery. There are different kinds of packages available. Different people who would have got it done for different rates. I don't want to get into the numbers, but one important thing everybody who is planning for TKR should understand: this replacement, we are replacing the joint. That means it has to do the job of a joint for at least 15 years, 20 years, 25 years. So if you are looking at something like a body part which is getting changed, which has to work for at least 20 years, 25 years, we should not be looking at only cost based on which we should decide our surgery. I'll give you an example for you to understand it better. If you are looking at any fracture where we use implants, again we use some plate, screw or rod or something, there are different kinds of implants available, but the job of that implant is to hold the bone together till it unites. That means only for 2 months, 3 months, if it is holding the bones together, the fracture will start uniting, and the role of that implant goes down to nil over a period of few months. But here in TKR, for that matter, any joint replacement, we are completely replacing the joint, and it has to work for your lifetime. If you are, say for example, if you are operating for a joint with 2 lakh rupees, if you are looking at 20 years it has to work, your cost of that joint for 20 years per annum becomes very, very, very less. So compromising there would give you a very small life of that joint, and when we have to redo that surgery, it's called revision, the cost becomes extremely high. That is one of the reasons why the TKRs are expensive, but it is always taken care to make sure that you will get the best implant, best possible solution with the least cost. There are enough measures taken even from the government side to cut down on the cost, so that people can get this a very, very successful and pain relieving surgery affordable. There are few more doubts: what kind of implants, whether they are imported, whether they are Indian made. These discussions I think we need to make with a particular doctor whom you are getting operated with, because the information is widely available in the open source. You can actually look up about different kinds of implants, processes, and then you can take a call. And if you really want to know what each and everything costs, why there are different implants, what is the advantage and disadvantage for each and every implant. At least from our side, we are ready to give you all that information as a second opinion, or to give you more information. We are available to give you that information.